I'd like to now talk about diabetes. It is, as I've mentioned before, 93% of Americans have insulin resistance, and 60% have diabetes or pre-diabetes. Most diabetics, as you probably are aware, are type 2 diabetics. I would say 95% of diabetics are type 2. Type 1 diabetics is a different disease in that people don't make any insulin and often have to take insulin as part of their therapy. We deal mostly with type 2 diabetes at maternity. It is important to remember that many people, in fact, the large majority, have had insulin resistance at least 10, 15, 20 years before they get diagnosed as a diabetic. You have to get your HOMA-IR insulin resistance score, your fasting sugar, your hemoglobin A1C. These are critical numbers, triglyceride HDL ratio. There are 3 or 4 very simple blood tests, and everyone should know what those numbers are and if you have insulin resistance. 20 years, 30 years ago, everyone was wanting to know, well, what's your cholesterol? Forget about cholesterol. In fact, the higher your cholesterol is, including your LDL, the longer you live. Statins given by Big Pharma is mostly not terribly healthy and helpful. I believe nearly 100% of people who have cardiac disease have insulin resistance. And this was well shown in the past by good physicians that it's really the sugar that's killing us, not the cholesterol. As most of you know, your brain is 70% cholesterol. Every cell in your body, all 35 trillion cells, every membrane is made out of cholesterol. And in fact, the more healthy fat you eat, the more weight you're going to lose and the quicker you're going to reverse your diabetes. It's not even the hyperglycemia, the high sugar, that kills us. It's the high insulin, the hyperinsulinemia, that is really the major problem. The other problem is that each of us has about 60,000 miles of blood vessels in our body. And that's why diabetes is such a dangerous disease, because it affects the lining, the so-called endothelium, of those 60,000 miles. So you have you have retinal problems, visual problems, you have strokes, carotid arteries get plugged up. They plug up your coronary arteries. You get erectile dysfunction. Often, a person who's getting erectile dysfunction, it's like the canary in the coal mine. Often those people, a few years later, will have a myocardial infarction, a heart attack. Why? Because the artery to your penis is a little smaller than the artery to your coronary arteries. So it's really a telltale sign when someone comes and sees us. I would say 75% of erectile dysfunction is all related to diabetes and hyperinsulinemia. Our goal at Eternity Medicine is threefold. We want to get your hemoglobin A1C under 5, your fasting insulin under 5, and your uric acid under 5. Uric acid is a very big toxin to your mitochondria, which we've mentioned before. So that is our goal with our diabetes program. This is a simple book. If someone wants it, you can always email me. I can send you an email copy of it. This is called the 4-Week Diabesity Cure. Diabesity is really a combination of diabetes plus obesity. And it's not my term. It was coined about 18 years ago. But this little book by itself can really, if you follow it, will probably help you reverse your diabesity. At our clinic, we have coaching programs. This is a big, thick book for coaches. And we also have a thinner book, which is the client manual. All our programs include the 12-week Diabesity Reversal, because we do feel that insulin resistance is at the heart of all this disease. We now have the opportunity of using continuous glucose monitors, which are a fantastic insight into what you're putting in your mouth and what's happening to your sugar and insulin. Things like the Keto Mojo, where we look at ketones. We now know that ketone salts are tremendously important, not only for diabetes, but for neurocognitive disease and neuropathy, etc. Anywhere you've got insulin resistance, ketone salts can be very, very helpful. Things like berberine. Berberine works as well or better than metformin. I think the Ozempic and Wegovy's, these can all help. They were originally, as you know, made for type 2 diabetes, but also they have a significant effect on weight loss and diabetes. Yeah. So obviously our program adopts, as all our programs, the integral acronym. So it's a whole person approach, not only reversing your diabetes, but reversing some of the chronic disease you might also have. Thank you.